She was once the rising star of the medical world. Now she mops hospital floors. But she never really left. Every night, she walks through those operating rooms as an invisible observer, mentally rehearsing procedures, keeping her skills sharp, because she knows that one day those skills will be needed again. And tonight, that day has come. Welcome to the Silent Legends. Before we begin today's story, tell us in the comments which city you're watching from. And if you believe stories like this deserve to be told, hit that subscribe button to support us. The night shift at St. Mary's Hospital was quiet. Only essential personnel walked the corridors, and Helen Martinez was one of them. 58 years old, greying hair, moving with silent steps. She pushed her cleaning cart, her uniform always impeccable, her manner always professional. But nobody knew she was Dr. Helen Morrison. 30 years ago, she was Harvard Medical School's youngest cardiac surgery department head. At 32, she had earned tenure, pioneered heart transplant procedures, and published groundbreaking papers in medical journals. Her future seemed unlimited. Until that night, a malpractice lawsuit, a patient with unexpected complications during routine surgery, investigation, media attention, and worst of all, the medical board's decision. License revoked, career destroyed, life shattered. But Helen never left. For 30 years, she had worked as cleaning staff at St. Mary's. She had changed her name, hidden her past, but never left the hospital, because medicine was in her DNA, and the cleaning job was perfect cover. Every night, while cleaning the operating rooms, she observed procedures, learning new techniques, studying equipment, conducting mental rehearsals. For 30 years, she had received invisible medical education. The hands never forget what the heart still remembers. 30 a.m. Helen was cleaning the operating complex. OR7, the cardiac surgery suite. A triple bypass had been performed here today. Helen knew every detail because she had done the pre-cleaning that afternoon. She carefully wiped the equipment. Heart-lung machine, monitoring devices, surgical instruments. Each time she touched them, muscle memory activated. Her hands still had that precision. "Helen?" She heard Nurse Sarah's voice. "Still here? Yes. Finishing up OR7, Helen replied, her slight accent barely noticeable. "You work too hard. Go home, get some rest." Helen smiled. "Work keeps me busy. Good for the soul." Sarah left, and Helen was alone. She loved these moments. Silent hospital, empty ORs, equipment ready for tomorrow's surgeries. Peace. But tonight would be different. At 2:45 a.m., the emergency alarm sounded. Code blue, OR3. Cardiac emergency. Helen immediately abandoned her cleaning and rushed to the corridor. Out of habit, training, instinct. Through the window of OR3, she observed the scene inside. A 45-year-old male patient, massive heart attack, crash cart active. And lead surgeon Dr. Reeves, obviously stressed, hands shaking. "I need a cardiac surgeon immediately," Dr. Reeves shouted. "This patient needs emergency surgery." "Dr. Martinez is 30 minutes away," a nurse reported. "Patient won't survive 30 minutes. Helen watched through the glass. Patient's vitals were critical, heart rhythm erratic. Immediate intervention was needed, or brain damage would be irreversible. And then, Dr. Reeves collapsed. Stroke. Sudden, severe, incapacitating. Now there were 2 critical patients in the OR, and the cardiac surgeon was 30 minutes away. Helen stood frozen. 30 years of internal struggle crystallized in a single moment. Save lives versus protect her secret. Medical oath versus personal safety. Who she was versus who she'd become. The patient's monitor was approaching flatline. Brain death imminent. Helen made her decision. She entered the OR. "Ma'am," You can't be in here, a nurse protested. I'm Dr. Helen Morrison, she said, her voice clear and authoritative. Former cardiac surgery department head, Harvard Medical School. This patient needs immediate intervention. The nursing staff was shocked. The cleaning lady suddenly speaking perfect medical English, claiming to be a surgeon? That's impossible, the head nurse said. You're Helen Martinez, cleaning staff. Check my hands, Helen said calmly. Check my knowledge. Check if I can save this man's life. The patient's heart rhythm was worsening. We don't have a choice, the resident doctor said. If she can help. Helen stepped forward, muscle memory taking over. 30 years melted away. She was Dr. Morrison again. Helen scrubbed her hands with the perfect technique from 30 years ago. Every movement precise, automatic, professional. I need a full cardiac surgical team, she announced. This patient requires emergency coronary artery bypass, 4-vessel disease, acute MI cardiogenic shock. Medical terminology flowed effortlessly. Diagnosis accurate, treatment plan clear. The nursing staff was still skeptical, but they had no options. Prep the patient for emergency surgery, Helen commanded. I need cardiac anesthesia, a perfusionist for the heart-lung machine, and surgical instruments. Now! The authority in her voice was unmistakable. This wasn't the cleaning lady anymore. This was a surgeon. First incision, perfect. Hands, steady, technique flawless. How does she know anatomy so well? Dins, the resident whispered. Look at her suturing, the anesthesiologist marveled. Perfect technique. Helen worked systematically, chest cavity open, heart exposed, pathology clearly visible. 4 coronary arteries severely blocked, heart muscle dying. We need grafts, she announced. Harvest siphonous vein from the leg, internal mammary artery from the chest, multiple bypass required. The surgical team was now convinced. This woman knew exactly what she was doing. Hours passed. Helen worked with surgical precision that amazed everyone. Her hands never trembled. Her decisions never wavered. Her technique never faltered. How is this possible? The head nurse whispered. 30 years as a cleaning lady, and she operates like a world-class surgeon? Maybe, the anesthesiologist replied quietly. She never stopped being one. Helen created 4 arterial grafts, each one perfect. Blood flow restored to the dying heart muscle. The patient's vitals slowly stabilized. Beautiful work, the perfusionist commented. I've never seen surgical precision like this. But Helen focused only on the patient. This was why she'd stayed. This moment, this opportunity to save a life when no one else could. Hour 6, patient stable, surgery successful. Hour 8, patient transferred to ICU, full recovery expected. Hour 10, Dr. Martinez arrived from home, shocked to find the surgery already completed. Who performed this operation? He demanded. The nursing staff exchanged glances. How to explain? Helen did, the head nurse said simply. Helen who? Helen Morrison, former Harvard department head. She's been our cleaning lady for 30 years. Dr. Martinez immediately called hospital administration. Emergency meeting, investigation, verification. Helen sat calmly in the conference room, still in scrubs. No longer hiding, no longer pretending. Dr. Morrison, the chief of staff said, reviewing documents, we've verified your identity. Harvard Medical School, former department head, specialization in cardiac surgery. But your medical license was revoked 30 years ago. Yes, Helen replied quietly. Why didn't you tell us who you were? Because I was ashamed. The malpractice case, the media attention, the board's decision. I lost everything, but I couldn't leave medicine completely. So I stayed. in the only way I could. As a cleaning lady. As someone who could still contribute, still learn, still be ready if needed. The hospital lawyer was present, concerned about liability. Unlicensed practice of medicine is a serious crime. But she saved the patient's life, Dr. Martinez interjected. The patient would have died without intervention. The chief of staff reviewed the surgery reports. Flawless technique. Perfect outcome. No complications. The investigation revealed the full story. 30 years ago, Helen's malpractice case was controversial. The patient had an underlying condition. Complications were unforeseeable. The outcome tragic, but not due to surgical error. The medical board, under pressure, had made a harsh decision, but later reviews suggested injustice. Dr. Morrison, the chief of the staff said, would you consider returning to medicine officially? My license can be reinstated, with proper review, continuing education, supervised practice initially. Helen had tears in her eyes. After 30 years, the possibility of redemption. But why? She asked. Why now? Because last night you proved you never stopped being a surgeon? You just cleaned floors between surgeries. The patient she'd saved, Michael Rodriguez, a construction worker with a wife and 3 children, would live. Perfect outcome. Complete recovery. His family visited the ICU the next day. We want to thank the surgeon who saved his life. Helen visited, still in her cleaning uniform. Ma'am, Michael's wife said, do you know where we can find the doctor? Helen smiled gently. Sometimes, she said, doctors come in unexpected forms. Your husband is going to be fine. That's what matters. Weeks passed. Helen underwent the formal review process. Medical knowledge current, surgical skills intact, competency verified. But she made a unique request. I want to continue the cleaning job as well. Why? The administration asked. Because for 30 years, the cleaning staff taught me humility. Patients need technical skill, but they also need compassion. Cleaning floors kept me grounded. The hospital agreed. Dr. Helen Morrison would return to surgery, but also maintain her connection to service work. First official surgery in 30 years. Success. Second surgery. Success. Third surgery. Success. News spread through the medical community. Former Harvard department head, worked as cleaning lady for 30 years, returned to save lives. Media attention, but different this time. A story of redemption, second chances, hidden heroes. 6 months later, Helen maintained her dual role. Mornings, Dr. Morrison in scrubs, performing surgery. Evenings, Helen Martinez in uniform, cleaning floors. Young medical students, inspired by her story, sought her mentorship. Dr. Morrison, a resident asked, how did you maintain your surgical skills for 30 years without practicing? I never stopped practicing, she replied. Every night, cleaning ORs, I mentally rehearsed procedures. Every day, observing surgeries, I learned new techniques. The hands remember what the heart never forgets. What did those 30 years teach you? Helen paused, looked at her hands. Clean now, but still carrying the memory of both mop and scalpel. That medicine isn't just about status or recognition. It's about service. Whether you're cleaning floors or opening hearts, you're contributing to healing. One evening, Helen finished surgery and changed into her cleaning uniform. A young nurse, confused, approached. Dr. Morrison, why do you still clean, sir? Because, Helen said, pushing her mop cart down the hallway, this hospital has many invisible heroes. Cleaners, orderlies, maintenance staff. They keep this place running while surgeons get the credit. I don't want to forget where I came from. But you're a famous surgeon now. Fame is temporary, service is eternal. Patient Michael Rodriguez, fully recovered, returned for a checkup. He saw Helen mopping the floor. "Excuse me, ma'am," he said. "I'm looking for Dr. Morrison. She saved my life 6 months ago." Helen looked up and smiled. "She's right here." Recognition dawned on his face. You were the cleaning lady that night. And you were the surgeon?" "Sometimes," Helen said gently. "The same hands that clean floors can also mend hearts. It's all about being ready when you're needed." Michael was emotional, grateful. "How can I thank you?" "Live well, love your family. That's thanks enough." Dr. Helen Morrison's story spread beyond hospital walls. Medical schools invited her to speak. Awards were offered, books were written. But Helen remained humble. "Every morning, surgeon. Every evening, cleaning lady." "Why both?" journalists asked. "Because healing comes in many forms," she'd reply. "Sometimes you save a life with surgery, sometimes you provide comfort with a clean environment. Both matter." Her office walls displayed her dual identity. Medical diplomas next to Employee of the Month awards for cleaning service. Young doctors learned from her example. True calling isn't about title or recognition. It's about readiness to serve when needed. 30 years of waiting. 1 night of action. A lifetime of redemption. Now I ask you, have you ever met someone like Helen? Someone who had great achievements in the past, but now does humble service. Sometimes the greatest experts are hidden in the most unexpected places. The cleaning lady, security guard, janitor. But inside them, extraordinary knowledge and skills are hidden. Tell us in the comments, who showed you unexpected expertise? Has someone who seemed ordinary ever revealed extraordinary knowledge to you? If this story moved you, don't forget to subscribe, because at The Silent Legends, we'll continue telling stories like this. And remember, sometimes the most skilled hands are the ones nobody notices. Sometimes the greatest experts are hiding in plain sight, waiting for their moment to shine again.